Namaste. So, what is common between Darwin, Isaac Newton, who is one of the biggest scientists, a most intelligent person in the world, Albert Einstein, or biggest warrior of the world, Napoleon from France, or you take any big name, what is the common thing amongst all of these? So they were all born premature. The prematurity is a common factor amongst these big people. Now, why are we discussing about this topic now? So November 15th to November 22nd is World Prematurity Week, wherein we celebrate World Prematurity Day on 17th of November. On eve of which we tell to convey the message to people that prematurity, which was once a taboo, once considered to be a negative thing that is happening in somebody's life, now we have expertise, equipments, and a great knowledge which we have developed, and we can make more and more support, more and more healthcare activities wherein we can make sure that these babies can survive well and be at par with the normal babies. So this is Dr. Babu S Madarkar. I am a neonatologist and clinical director at KIMS Cuddles, Secunderabad. Today we are here to discuss about the prematurities, issues with related to that from maternal perspective and neonatal perspective.
Hello, I'm Dr. Vasundara Cheepurupalli, Consultant Gynecologist, Laparoscopic and Robotic Surgeon, and a high-risk obstetrician at Cuddles, Secunderabad. So, as Dr. Babu has already said, so Prematurity Week we have been celebrating, and it is very much important to know how the prematurity babies are handled here, and how the prematurity is addressed when it is the main concern in taking a decision. When the things are not going smooth in pregnancy, parents are much worried in taking decision. So when to deliver, whether we have to continue the baby pregnancy or not, all these things are important. So we'll discuss we'll take the opinion with the Dr. Babu and how the system and how the conditions and how the facilities are here, and how parents can be reassured.
So Dr. Vasundara, I had this concern that India is producing around 2.5 to 3 crore babies per year.
Yes,
so of those, around 10 to 15% of them are preterm babies. So which means that load is immense.
Yes,
we are actually producing around 25 to 40 lakh babies a year,
yes,
which is a huge load. So what do you think is happening in the globe, or in fact in India as a specific scenario, wherein why the numbers of preterm babies are the deliveries are happening more and more?
Yes, sir. So the preterm births come with high-risk pregnancies.
Okay.
So always the high-risk pregnancy women usually land up with the preterm deliveries, and preterm babies come.
Okay.
So usually previously when we compare with the ages like 2000s and early and before that, all the pregnancies would happen before 25 and less than that age.
Okay.
Now the age of marriage has been increasing,
and that is one very important thing that we are saying.
Sir.
Everybody is behind this career formation, and then these things are lagging behind in terms of time to get married.
Yes, sir. After that, after getting married, they're taking some more time, maybe for financial settlement or to understand each other, and maybe for all the things to get settled.
Okay.
So by the time they are planning conception, their age is nearing 35, sir, in and around. So maybe this age definitely is putting a pressure on the into the high risk category, definitely. And apart by this age, the women or any couple will be landing up with certain complications, age-related complications like high blood pressure, or diabetes, or any heart issues which are undermined till then, which come up and they put pressure and complication to the pregnancy. And definitely the infertility rate is also increasing. Previously, the fertility was not that concerned. These days, every street is having an infertility center. That indicates that how the fertility burden is on our country. So maybe this with fertility aids, and definitely the age related, maybe environmental changes, and maybe lifestyle modifications. All these
the stress that people are facing.
Stress. maybe nuclear families wherein the lack of family support is not
Correct.
there. So all these are putting up into a high risk pregnancy.
So if I have to correlate this, during the time of COVID, when everybody was staying at home,
Yes.
when they were in a joint families and
Yes.
staying at home,
Mm.
we found that there was dip in premature rate.
Oh,
The reason behind was that people were not having stress of
Stress.
work. They were not going out.
Yes,
They were
sir.
at home, comfortable.
Mm.
And then after that, when the people have started again working, they have to have that early morning wake up, getting ready for the work, running in the traffic, getting adjusted to the work atmosphere, and then come back, take care of the family. All of this add a lot of stress, and then
Yes.
we are in that rat race of excelling. Every point we have to excel, and beyond that there is again a next point,
Next
set,
target.
next target set for us, and
Yes,
then that keeps on happening, and
Yes,
then
sir.
body suffers.
Yes, sir.
That's
Yes,
how.
sir.
That's how.
Sir, I would like to ask you a question here.
Mm.
So, as long as the pregnancy goes smooth and the baby delivers at time, so your role comes just in checking whether the baby is doing good,
Correct.
or vaccination or something.
Correct. Yeah.
But your role plays a critical, when the baby, when the decision has to be taken at around 30 weeks or below that.
Yeah.
So, beyond 30 weeks, usually parent will be inclined for any way to continue pregnancy,
Yeah.
or in any way to support the pregnancy.
Correct.
In the neonatal period.
Yeah.
They don't think much.
Yeah.
But below 30 weeks, they'll all be struggled to take a decision.
Correct.
In that situation, how do you counsel? How do you reassure the parents, and how do you tell them to continue the pregnancy?
Yeah. So it's a very tricky situation for us, because the decision of continuity is dependent on multiple factors from parents' perspective. One thing is, if it's a first pregnancy, then some of the families tell us that if it's a first pregnancy, then we still have option of having subsequent
Yes, sir.
pregnancy.
Yes, sir.
And in a scenario wherein the pregnancy is immensely precious, like something like a mother is 40 years old, and then the conception has happened after many efforts. And those times they do not want to leave any stones unturned. They would want to continue.
Yes.
So overall, if you have to say, as the age of gestation keeps on coming down, 30 weeks, 29 weeks, and in fact those days are also important.
Yes.
So we have been in KIMS Cuddles Secunderabad, we have been able to make be part of the treatment of babies who are even 25 weeker, 24 plus 6 was the last, wherein they have survived. But then long-term effect of the survivability is that then they might have issues with the eyes.
Yes, sir, that is what they question.
Yeah.
So it is not about the coming out of is the coming out of NSU.
Yeah.
It is the long-term outcome, like psychological and developmental
wise, psychological history.
What do you say regarding
retinopathy of prematurity, growth, and then being able to achieve those milestones which a normal baby achieves. So there are some activities that, apart from actual treatment of the baby, there are certain activities that we do in the NICU, which is called as developmentally supportive care, which includes positioning of the baby, pain management, sugar control, oxygen control with a normal limit, pressure control in the ventilation. If all of these are well managed and well achieved within the normal limits, the chances of this baby going into normalcy is very high. But then it cannot always be assured, because the baby might have infection, might have some issue, and suddenly there might be fluctuation. But then because of the newer equipments that we have, newer expertise that we have, newer advances in the medications that we have, we are achieving as near as normalcy, but we are still have to achieve that normalcy. We still are behind.
Yes.
So supposing we give them examples of the previous babies.
Yes, sir.
That is what sometimes is helping us to take a decision.
So supposing the baby comes out from NSU with flying colors and all those, baby, parents will be very happy. But the next question I think they may put you is how long-term protocol, development will be. Will there be any neurological deficits? Will there be any eye problems and all those? Will they behave as a normal other baby? Will they be catching up with the will they be catching up the growth with other babies? They put you, I think
these questions, they keep happening. Even when the decision is made, even during NICU stay, even during discharge. So we have a scheduled protocol for evaluating a neurosonogram, eye evaluation, hearing evaluation. Those protocols we follow, scheduled time at the specific times. If those things are followed at specific time, the outcomes are nearly normal. That happens.
They will be on par with the other normal.
At par with that.
Okay.
But if at all, let's suppose there is a bleed in the brain, which can happen for a smaller baby. If it is of the lower intensity, still we can manage. If it's on higher intensity, and then there are some signals that we get that this child, although might get survived, but might have long-term neurological issues, we tell to the parents that this is a scenario.
Yes.
But usually now things that we speak are of today's age, which is 2024. Maybe we might have solutions for those things even, coming years. So most of the parents now have come to a consensus that since this is improving, coming days the child might improve, and most usually if they are well convinced, they continue to take care of the baby. I wanted to ask you, from neonatal perspective of a baby, what all those things that you do for preterm delivery, so that it has a good implication in the newborn baby?
Sir, usually the first successful outcome begins with the delivery at the higher center.
Correct, sir. Correct.
Because
this I completely agree.
Yes, sir.
This is one I've been working in previously in other places also. Unless it's a good team of obstetricians and good team of neonatologists working hand in hand,
Yes, sir.
Unless this happens, the outcomes are not going to be good.
Sir. Yes, sir.
So obstetricians' work becomes easy because they have a backup of neonatologists. Neonatologists' work also becomes easy because they have very good obstetricians who's taking right decisions at the right point of time.
Yes,
so only then mother and baby can do good.
Yes,
so
sir.
I think we should be proud of this fact that we are working together. We have a very good backup of, you have very good equipment wise, you have expertise in not only this obstetrics, you have expertise in robotic surgeries, minimally invasive surgeries, laparoscopic surgeries, and that is actually a strength for us.
Yes, sir.
For newborn baby as well, when we are ready to take the baby, but then the decision to make sure that baby is delivered at right point of time.
At this point, many people think that it is we get the delivery done at one point and we'll ship the baby to a higher center if needed. So then the decision, the outcome might differ.
Exactly. I agree
because whenever the patient or the pregnant lady is diagnosed or labeled as a high risk center, it is always better to get delivered at a
high risk
NICU backup area only.
Correct.
So that immediate neonatal resuscitation is the key for the outcome of the baby.
Correct.
So in that point, we definitely counsel.
I interrupted you. You're saying about delivering the baby in good center. What else are the things that you do with respect to good outcomes that you would, if you want to have a newborn baby?
Actually, sir, whenever we get a patient of, whenever a referral or any inpatient of, with a high risk category, so we assess the condition and we will have a simultaneous discussion with the neonatologist, counseling with the neonatologist, and we'll take a decision when to deliver the baby. And the first always our intention would be to drag the pregnancy as long as the mother and fetus are good.
Many times you have tried your best to drag to as much as possible to achieve good maturity in the baby and being able to have a good medical termination when what is a pregnancy. And then you also give antenatal steroids.
Yes, sir. So in conditions where that prolongation of pregnancy is not possible. So for maturation, lung maturation of the baby, so that the baby won't suffer much in the neonatal NICU. So we give certain injections for early maturation or early lung maturation or early lung functioning. Good functioning of the lungs.
Previously, my perception, when mothers who were impending in preterm deliveries, if we're not given antenatal steroids, we have seen those babies suffering a lot in NICU with a lot of ventilator and struggling, and in fact some of them dying. But since you are following this 100% coverage of antenatal steroids, our requirements of ventilator has come down. Our requirement of surfactant, which medicine which we put into lungs for lung development, also has come down. I think it's all because of the activities that you do in the before the delivery.
And another protocol we have been following is the Maxwell regimen for the brain development of the baby.
So these I have to admit that Maxwell regimen that you're using, it is helping in brain development. And then the antenatal steroids that you're using for mothers, it is predominantly helping in lung development. So brain and lung, both of them, if they are well protected, usually things for neonatologists becomes very easy for us. We have to just make sure that baby is not going through the infections,
Yes, sir.
and then we continue to take care of the baby in an ICU, and then baby subsequently does really well.
Yes, sir.
Okay.
So with all these protections, when the things are not going smooth at the end point of the termination, only we are terminating the pregnancy,
Okay.
and we do a delivery in a condition where the neonatology backup and all equipment is ready to retrieve the baby and to take the baby to the NICU where the support is aggressive.
Yeah.
So that in these conditions, sir, so how what is your say on the immediate resuscitation of these premature babies?
Yeah. So when the baby is, I mean, if we say even in terms of a common sense,
Yes.
if the baby is in the mother's womb, baby is getting continuous supply of oxygen, continuous
Yes, sir.
supply of blood. A baby doesn't have to strive hard.
Yes, sir.
Once the baby comes out, baby has to start breathing.
Yes, on
So
its own.
on its own.
On its own.
So here the lungs are not well developed.
Well done.
And baby cannot breathe. The lungs are almost sticky like a wet sponge. And what we require is lungs, something like small balloons which can easily expand. So if the attendance of the baby in terms of resuscitation happens immediately after delivery, outcomes are going to be very good. We call it something called as golden minute management or called as golden hour management.
Yes, that is
so very important. What we do in initial part will dictate the lifelong outcomes.
There comes the high risk center delivery,
Correct.
wherein the neonatology support comes immediately.
Yeah,
There we won't miss any golden hour.
Correct.
Yes,
Correct. So again to reiterate, to have a very good outcomes in preterm babies care, it is not a job of neonatologist alone.
Yes,
it is always combined efforts of a good obstetrician and a good neonatologist, and their team effort will not just make 1 + 1 2, it will make 1 + 1 will become more than 2.
Yes.
So it actually has to be dealt in such a way. It has to be, I always call it as team of perinatologists.
Yes.
Both of them are part of the same spectrum.
Yes.
So some of other things I wanted to ask, of all the causes that you enumerate from in terms of reasons for preterm deliveries, which are the common causes? If you put it in the,
it is the preeclampsia is the first cause,
okay.
sir.
Okay.
Preeclampsia is the first cause, and second comes the maternal medical conditions which are putting pressure on the pregnancy, sir. So many almost of the all preterm deliveries what we have been doing.
I remember
preeclampsia is the first cause.
I remember a couple of cases that you have done before. The medical conditions, when you said, I remembered about those SLE mothers.
SLE complicated
pregnancies. And you have a long list of SLE cases which you have managed.
Yes, sir.
SLE per se, if you say,
we have been maintaining a register of SLE complicating pregnancies and liver diseases complicating pregnancies. Also, it is a very dreadful condition wherein delivery is the only option in order to save the mother. So unless they will be left with no other choice apart to deliver. So their mother has to be saved at any point of time. So there prematurity comes, and other conditions are in heart diseases complicating pregnancy where mother will not be able to support the load of the heart. So because of the pregnancy we have to terminate the pregnancy in order to lower the risk.
Correct.
Yes, sir.
So since you mentioned about this medical conditions,
yes, sir.
I remember one recent case which was managed by the Cuddles team, wherein mother comes to the emergency.
Yes, sir.
And she was pregnant with twin babies, and then she suddenly went into cardiac collapse.
Yes, sir. Yes, sir.
And then she had a cardiac arrest. The chest compression CPR was done to the mother,
yes,
and then intubated when mother was shifted to ICU, and then mother was subsequently shifted to operation theater for doing cesarean section.
Yes.
And then preterm babies were delivered.
Yes.
And then these preterm babies were taken care of at NICU, and mother was taken care at ICU.
So all these will happen at a high risk center, wherein mother gets the ICU support and the babies get the NICU support.
So these very critical scenario, we cannot imagine pregnant women with twin babies coming to emergency and collapsing. And eventually after some 15-20 days going home with the babies and
yes,
it is such a satisfying scenario to see.
Yes, sir, that can really happen at places where a tertiary or quaternary support is there, where mother gets adequate 24/7 support along with the babies. And of course, a little bit of luck factor has to be there.
Has to be there. So the high risk obstetrician, for good outcome of babies, requires neonatologist.
Yes.
But then high risk obstetrician, which you also require a backup of very good pediatric ICU. I mean adult ICU. Cardiology, nephrology,
yes,
blood
multidisciplinary,
bank,
multidisciplinary
so
services.
in this scenario, we are actually doing the quaternary care scenario service.
Definitely.
Wherein I feel, even if there is a scenario wherein a mother collapses and I mean all the procedures done, if there is requirement of renal transplant, liver transplant, will also be done in this center. So this is only possible when you have basically expertise, which we are, facilities, high-end equipment, and then a team effort. Only then the outcomes are going to be good. Then we have to be accessible to people, and then we have to be equally affordable to them. Then it gives wholesome result in terms of being equitable and being able to have our services all across the places. So can you just continue in terms of your experience in the past, so many years of your practice with respect to preterm deliveries? What have you been seeing the change in the outcome?
Definitely. Maybe when we compare with the past few years, so previously we would think a preterm, how the preterm baby will come out, and how the neonatology outcome and how the long-term progress will happen. So with the extensive support of our NSU or any kind of the pediatric in the pediatric and the ICU and all the multidisciplinary supports, so definitely the outcome and the long-term progress has also increased. And definitely the patients, it is preterm baby is no more a taboo these days. So previously a preterm baby would be labeled as a preterm baby, and the parents would always be at stress how this baby is going to behave down the line. So now with this equipment, with this infrastructure, with the expectations what we have, and with all the multi-speciality, not adult multi-speciality, with all the pediatric and the neonatology multi-specialties. So with these experiences, definitely we have been giving a good care, and preterm birth handling is no more a troublesome these days. Definitely.
So like in continuity of what you said, multi-speciality services even in pediatric and neonatology also. So we had one baby who has had a bleed in the brain. So this baby also had bleed in the intestine. So this baby was seen by hematologist because he is expert of bleeding.
Pediatric
hematologist, and then pediatric neurologist, pediatric gastroenterologist, because there was this pediatric surgeon, and then the ground was by the neonatology. So we made sure, because of this team effort of multidisciplinary approach, we were able to make sure that the baby did well, discharged well, and doing well at home. And this was not possible if only one doctor, only neonatologist is there. So there's a requirement of expertise.
Has to be a multidisciplinary at a high-end backup services.
And the expertise of Cuddles, if I have to again reiterate, and I can say the specialty. If a baby or a mother comes to Cuddles and gets admitted, we are so comprehensive, so exclusive that we don't have to make sure. I mean, the patient need not go to cardiologist and then next floor of neurologist, and again second floor to gastroenterologist. It is the doctors who come to the patient. So that makes the whole services easier, and then the continuity happens in a good way. So I think the discussion that we are having is we are trying to be more and more relatable to the viewers who are watching us. I think I request all the viewers, you can have interaction with us now, and then discuss any kind of problems that we can discuss over here. I have to say that women and child care is actually misperceived as a minority care, because women and child care, usually it's a separate small building which is usually there in some part of the hospital. in reality, if I have to say, 50% of Indian population is women and 35% of Indian population is children. We actually contribute to 75 to 80% of actual population. We are actually in terms of majority.
Yes.
And it is this 35 population which becomes the biggest base of this pyramid.
Yes, sir.
They are the future of India.
Yes, sir.
So it becomes our duty as obstetrician as well as neonatologist
to build up the base strong.
build up the base strong. So this is only possible when we start our work even before they are born.
Yes, sir.
And then when they are born, and then give them morality, ethicality, and good education. Only then we can see a good India coming up in the near future. So, so mother and child care is not a dead end specialty. It is a multidisciplinary thing, and then outcomes are going to be only possible when we are doing in a interactive
Yes,
in a good manner
with a strong team.
With a strong team. So, viewers, if they have any questions and queries, we can have a discussion. I can even if it is a small query, it is going to be actually a big query for the need of the scenario. If a child has some concern, if a baby has some concern, if a woman or a expectant mother, pregnant mother has some concern, we can have a discussion over here. You can ask questions in the chat box, and then those questions will be answered, and we can, I mean, even if it is small, but for the baby it might be a bigger solution. So if I see through the live session, there's so many questions. There are so many questions there. I think I'll start reading one after the other, and Dr. Vasundara can answer if it is belonging to her field, and I'll answer if it is belonging to my field. Question is, why should we expect immediately? What should we expect immediately after our baby is born prematurely? So I think I'll answer these questions. You know, usually when the baby is born prematurely, the internal organs which are vital, the heart, lung, and the brain, they are the most important organs. And other organs are also important, but then vital organs which help in continuity of life, they are not in a mode of functionality. So we might have to make sure that heart functions well, lung functions well, and the brain functions well. For functionality of lungs, we start with the artificial ventilation if there is a requirement. For functionality of heart, we start certain medications which will pump the heart. Likewise, we also make sure the brain is also functioning well, and then we give little time for the baby to be shifted in incubator, and then we try to nurture the baby in incubator and take care of the problems which we face in the NICU and keep coming out of each of those problems. So next question is, how can we best prepare ourselves to visit and support our baby in the NICU? NICU is a place where there is a sterile environment, because we have to make sure that baby is not acquiring any kinds of infection. So we make sure that baby is getting best care as well as parallelly. So mothers should go to the NICU to take care of the babies. Usually mothers do not transmit infection because it is the baby which has come from the mother, but it is always advisable to non-mothers, any other people, to not to go into NICU unnecessarily. And then next question is, what are the most of these questions are for the baby's point of view. Now, I think there will be many questions. I think this is because now we have World Prematurity Day. So
it is better you answer so that they get some clarity.
Yeah.
You know, they'll be having lot of questions.
Yeah.
At the at the counseling room, they get prepared to ask all the questions, but the time they forget.
They forget. Yeah. So how can we help with feeding, and when can we start breastfeeding or bottle feeding? So breastfeeding has to be started in normal babies as early as possible. We say within first hour, whether it is a normal delivery or whether it is a cesarean delivery. But then sometimes because of practicality, it might get delayed in cesarean delivery. So upper limit in cesarean delivery is 1 hour. But in preterm babies, it depends on the gestation. If the baby is very tiny, we cannot feed the baby. We tend to give all the nutrition through the vein. But if the baby's intestines are able to move, are able to digest, then we start with the tube feeding. And then what kind of follow-up care and specialist will baby require after leaving the hospital? These babies might have, like I said, might be premature in their development of eyes, brain, ear, heart, lung, intestines, bone. So all of these have to be followed up.
Sir, how long do they need the follow-up, sir?
Yeah,
Usually,
usually,
there for their lifetime or to certain
yeah.
period.
So usually they say the catch-up growth.
Yeah.
They catch up between two to 3 years.
What would be the age, sir?
They catch up between 2 to 3 years.
Okay.
Earliest is 2 years and
Okay.
latest is 3 years.
Okay.
If a baby is little preterm,
Okay, sir.
they'll catch up before 2 years.
Okay.
If the baby is very preterm, like something
Okay.
like 25 weaker, they'll
Okay.
take up to 3 years to catch up.
Okay. Okay.
After that, they'll be at par with any other normal
Okay.
baby. So we follow them till 2 to 3 years.
Okay.
Beyond 2 to 3 years, we ask pediatricians to follow.
Okay.
So we neonatologists only follow
Even
that.
with the pediatricians, they need to visit the pediatrician whenever needed.
Yeah,
It
yeah.
is not that it is being a preterm,
Yeah.
they have to have a lifetime follow-up.
Yeah.
That is not,
that is not the
that's
thing.
not,
So
yes.
the catch-up is between 2
Yes.
to 3 years. So specialists, and then what are the best ways to handle the visitors and protect the baby from infections? So I mean, this is a common thing. I mean, even mothers are also they also have to be protected against infections.
Yes, sir. Yes, sir.
So what we say is let the baby and mother, we call it as dad, they have to be in the room, and there should not be easy flow of air from the window. The temperature of the baby has to be maintained every time when the baby is handled. We have to make sure that baby's our hands are mother's hands are well washed, and then unnecessary visiting to the both has to be.
Yes, the kangaroo mother care can be given by fathers as well, right?
Yeah.
Yes, that is
the
an
kangaroo mother
important thing,
care, all the mother name is there,
Yeah.
but can also be given by father, grandmother, or mother, sister,
Yes.
Anybody
can
give a
kangaroo.
kangaroo
So
mother.
that improves a better outcome.
Yeah, it gives a very
that
good
gives a
outcome.
very-
It increases the weight,
Yes, sir.
increases the brain development,
Brain development,
milk production, temperature maintenance,
yes.
infection reduction, hospital visit.
Hospitalization. stay
Yeah,
will
all
come
of
down.
these will
Yes,
improve.
sir.
So one question, I think I think this is your question. Can you suggest any insights or methods to reduce the risk of having preterm babies?
Yes, sir. The regular follow-up is very much needed. And apart from that, prenatal counseling, preconceptional counseling is very much important, sir. It is to identify risk factors at time, and getting treated them prior ahead of conception is very much important. So if we get them treated prior ahead to conception, we can put them under control, and chances of high risk pregnancy and preterm deliveries can be many times.
How to do this preterm conception? This thing is a kind of a new concept.
Yes, sir.
For
Prenatal counseling and
it's
preconceptional counseling is a new concept, sir,
especially
definitely.
in Indian scenario.
Yes, sir. As you already said, all the ages of conception, right, these days are in 30s only. So by that time, they will be reaching their age-related, they will be developing their age-related issues. So it is very much needed as for to identify what all risks we have, whether we have a thyroid, whether we have hypertension or diabetes, or any other systemic conditions, or any other medical complications. So to get ourselves checked and to make sure our body is all prepared to take up a pregnancy, and then to go for conception, it helps in good establishment of the baby, and helps in reducing the multiple miscarriages, and helps in a smooth outcome of the pregnancy. Unless we treat them prior to conception, so these will develop during pregnancy. So it is very easier to treat them prior to pregnancy,
before getting ready
so
for
that
the pregnancy.
prematurity can be prevented many times.
Yeah. So one question, very interesting. They say, now I have had a preterm delivery. What are the chances of me having one more preterm delivery in subsequent pregnancy?
Yes, sir. It depends. Many times preterm deliveries are medical related, or any other conditions which the patient is prone to. Some are unexplainable, sir. So if it is unexplainable thing, we say that next pregnancy might go in a normal way. If the patient has any of the medical condition, there is every chance for recurrence of preterm in the next pregnancy. The thing is, as is already said, preconceptional counseling and preconceptional evaluation of ourselves to find out whether we are fit to take out the pregnancy is very much important, so that next time recurrence can be reduced.
Yeah. So for those of you who have had an experience of preterm deliveries, I request you all to meet madam when you're planning for next pregnancy and be in the follow-up, so that we are well prepared for everything, so that outcomes are going to be definitely good. Yeah. So one more question out of you can say fear, same kind of question. So she says that I am having a twin conception. Now, am I at the risk of preterm delivery?
Yes, sir. For twins is categorized as a high risk pregnancy.
Yeah. So
And
twins, triplets,
many
and then,
times twins can also be dragged till 37, 38 weeks, the term gestation. And unfortunately, in certain conditions where mother medical complications add up, or if the mother is not able to carry the twins till term, the chances of preterm are high when compared to the normal pregnancy. But
again, I mean, we should agree on the fact that need not worry.
Yes, need not worry. Yes, twin pregnancy can go smooth.
Yeah. So, so there is one more again a similar kind of question out of fear. I mean, in fact, it's a question not just of fear; it's also a question which will improve the knowledge. So the mother has a history of miscarriage and abortion in the past. Now she's planning for conception and delivery, pregnancy basically. So is she also at risk of preterm delivery?
Abortion, if we can find out the reason for abortion, that can sort out our
if we are having specific reason why that abortion has happened, and if you're able to treat that reason, then we can hope for the good outcome. Yes. So the next question is for me: are the preterm babies are more prone for infections or chronic conditions? Yes, these babies are more prone for infections in the initial times. When they catch up, they tend to be at par with the normal babies. Preterm babies in NICU are prone for infections because of various reasons. One is because they themselves do not have good immunity, and then all this air, somebody touching, injections, all these things will increase. Yes. So we tend to make sure in the babies we try to avoid unnecessary touch. Yes. We try to avoid IV medications. We tend to make sure that the baby is achieving full feeds as early as possible, and minimal handling is what we practice. Yes. So long-term chronic conditions, they can have chronic conditions, something like deficiency in the hemoglobin production, something called as anemia of prematurity. And then they can have osteopenia of prematurity, which is bone weakness. They can have decreased vision because of various myopias or refractory errors or retinopathies and all. But all of them are preventable, and all of them treated. All of them can be treated. So, can you suggest insights of risk of having a preterm baby? So, if you have to just number 1, 2, 3, 4, 5, 6, you do this, then the risk will come down.
As I already said, it is the prenatal conception counseling.
So before that, you had also told about plan your life well.
Yes, sir.
Marry at right time.
Yes, sir. That is very much needed these days.
This is one thing.
Yes, sir.
And before that, before you marry, make your nutrition, your bodily nutrition has to be good.
Yes, sir.
So that your uterus is able to sustain baby for full 9 months.
Yes, sir. Definitely.
And after that, you're saying also about make sure that your chronic conditions that you're suffering are treated.
Yes, sir.
And then preconceptional counseling that you said, and then being in good
regular
follow. And any deficiencies in the nutrition that you're having will be taken care, and then you can make sure that preterm babies, you will not have preterm babies, and then if at all you have, will be well taken care of. And then can preterm baby affect my future pregnancies? Birth of preterm babies affect birth of my future pregnancies? That you have answered.
Yes.
So, can infections during pregnancy lead to preterm delivery?
Yes. Yes. Specifically, vaginal tract infections can weaken the cervix, and they land up with a preterm delivery.
Yeah.
So the bacterial vaginosis or any other conditions which weakens the cervical and the pelvic blood supply and supports may land up with a preterm delivery.
Okay. So what are the delivery options for a preterm baby? How can you decide between vaginal birth and C-section? Basically,
Yes.
they're asking how will you decide if it's a preterm or whether it's a
C-section. Sir,
so
it is
if
a
it is
tricky question, sir. Actually, if you feel that the baby's survival chances are good, if we give a immediate neonatal support, then we prefer C-section, sir. Because in vaginal delivery, the baby has to undergo through so much of stress. So instead of putting the baby into stress and handing baby to NSU, wherein they'll not be able to support, so it is better we do a proper C-section and handle the baby in a
overall, if you have to say,
yes.
it depends on case to case
Case
basis.
to-
Case
yes,
to case
sir, it
basis.
depends on
That
case to case.
scenario will decide about
Yes,
how
yes.
it has to happen. And then how can we help with the feeding, and when can how should we take care of the feeding of these babies? Anyways, if the baby is less than 28 weeks, we tend to initiate feeds. But then if the baby is less than 25 weeks, we cannot give the feeds. We only give all this nutrition, proteins, fats, and minerals through the IV or umbilical route. If the baby is more than 34 weeks, we tend to initiate with the spoon feeding and then try to hike up further. So it all depends on mental maturity of the baby and then physical weight as well. And can infection. Next question is, what are the delivery options for preterm delivery? That is the answer. What are the common causes of preterm deliveries and how can you prevent it is also answered. How a preterm child having feeding apart from EBM when is baby 9 months of age? I think the question is premature baby is given feed is giving feed from express breast milk. Apart from express breast milk, do we have options of feeding this baby? So normally what we say is the best milk is mother's milk, next best milk is donor's milk, next best milk is formula milk, and the last, and I mean last I will not keep in the fourth option. I will keep very low. It is cow's milk or animal milk. So best milk is mother's milk. So next best milk is donor's milk, and even in the donor's milk, it has to match to the gestation. Somebody is 34 weeker, we have to, if this baby is getting 34 weekers donor's milk, only then this is going to be good.
Yes, sir.
So because this donor's milk, I mean the preterm milk is more thicker, more proteinaceous, more in minerals as compared to term milk. Usually it takes around 21 days for it to come to term's way. So which is why the preterm babies, when they are growing beyond 2 weeks, their requirements is far high as compared to a term baby. So we have to add supplements. So we calculate vitamin A, B, C, D, E, K. We calculate all these minerals: copper, zinc, iron, calcium, phosphorus. We calculate macronutrients on everyday basis. All the medication that we give, vitamin A is given as 1330 units to 3330 international units per kg per day on that day. Next day when the baby is increasing by 10 grams, again we have to calculate. So this whole thing is tiny, delicate, and extremely sensitive. So the drugs that we give, the medications that we give in newborn babies are something like this: 0.0001 micro unit per kg per minute. If it is little more, little less, baby will work. So we have to be so delicate in terms of cautious and in terms of taking a step. So how a preterm child can be given feed, that has been answered. I think I think most of the questions, I mean, there are many lists of questions that are coming up. I mean, the number of questions coming up actually answers to the scenario wherein the requirement of the mother and child care is well addressed for. So I feel as the numbers of questions are coming up, so over a period of time as they are accumulated, I and Dr. Vasundara will try to give our time, sit on this in front of the system, try to answer those questions. Any small question is actually not small question, because that is a big question for the baby. So we will continue to answer the questions as they come in the YouTube. So in the end, we would want to conclude by saying some of the things. We at KIMS Cuddles Secunderabad are having a very big team of obstetricians and pediatricians with multiple specialties. So this big team is there to give best of the services, backed up by high-end scientific expertise, high-end scientific equipments, and then holistic approach. And additionally, the women and child care services require good sense of emotions, emotional touch, and good sense of that sensitivity, unless which we cannot offer that kind of tailor-made solution for any kind of women and child care. So I request you all the listeners of the live program and listeners of subsequently also, that anytime you require any kind of services with respect to healthcare of mother and baby or a child as a whole till 18 years of age, we at KIMS Cuddles Secunderabad are open for 24 hours on all the days. Please take the best services from us. So Dr. Vasundara also can also add up to this.
Yes, as Dr. Babu has briefed everything about the Cuddles Secunderabad. So we are available 24/7. We are ready to help, and we are happy to help you always.
So thank you very much for your patient listening.
Thank you.
So I think we'll keep on meeting you all more frequently and more periodically, which will help us to bring about good change in the local and surrounding population. Thank you very much.